Thank you.
Thank you, Sue. Well, good evening, everybody, and thank you so much for having Shaheda and myself here today. So as Sue said, my name is Sally, and I work for Action on Postpartum Psychosis, or APP. So APP is the UK national charity that supports families affected by postpartum psychosis. So we offer peer support, information and resources. We train health professionals, facilitate research, raise awareness and campaign for better services. So we're here today to talk to you about postpartum psychosis, so what it is, what it's like to go through it, what you might need to know about the management and support for families affected. So please do take care of yourselves in this session. We will be discussing topics related to severe mental illness and suicide prevention. So please do get in touch with APP if you need any support. So my background is in academia as a lecturer and researcher up in North Wales. In 2015, I gave birth to my daughter. I'm not going to go into too much detail about my experience because we could be here all evening, and Shaheda is going to share in more detail her story with you in a bit. But just in brief, really, in the hours after giving birth via emergency C-section, I became very confused. I couldn't make sense of time. My brain was on overdrive. I couldn't sleep, and I just knew that something wasn't quite right. So I was admitted to a general psychiatric unit and separated from my daughter 5 days after giving birth and diagnosed with postpartum psychosis. So due to the lack of specialist services at the time when I was ill, it took me quite a long time to access the right treatment that I needed. So for me at that time, it was antipsychotics, antidepressants, anti-anxiety, and eventually electroconvulsive therapy, or ECT. So it meant it took quite a long time to recover and had to work through everything that had happened. But I am so far from where I was then when I gave birth. The midwives who were on the labour and postnatal ward played a huge part in my journey. So caring for me in those kind of frightening first few days and hours and advocating for me. So I'm not sure I'd be here talking to you today without them. I just wanted to let you know that before we start. So I'm going to talk to you about what we know about postpartum psychosis first. So we know that for some people there is a higher risk of developing postpartum psychosis. So these include those who have got a history of severe mental illness, such as bipolar disorder or previous postpartum psychosis. We also know that with an immediate family history of bipolar or postpartum psychosis, there's also a slightly higher risk than the general population. However, we do also know that approximately half of all the cases of postpartum psychosis develop out of the blue. We call it out of the blue with no previous kind of serious mental illness. We also know that postpartum psychosis can affect those giving birth from all different backgrounds, classes, cultures, education levels, which is why it's vital that all expectant families and frontline health professionals know about it and can spot the signs and symptoms. So it really can happen to anyone giving birth. So whilst we acknowledge that the idea of pregnancy complications can be quite scary, we shouldn't pretend that they don't happen. Some of the fear surrounding the illness comes from the stigma around the illness. So presenting the facts, talking about the help that's available and sharing the knowledge that people do recover helps to address that stigma. So very briefly, I'm just going to go through some of the things that we need to know about postpartum psychosis. So we know that PP is a severe, frightening postnatal mental illness. It can be very scary, but with the right treatment and support that people can make a recovery. So whilst it's not as common as other perinatal mental illnesses, it is, as far as kind of serious complications from childbirth go, PP is one of the most common. And it's actually considered a medical emergency. So we know that the signs and symptoms can vary amongst different individuals, and they can come on very quickly, either towards the end of pregnancy or quite quickly after childbirth. So some of these symptoms might include mixed mood, so feeling very high and feeling very low, and this can fluctuate really quickly. Confusion, racing thoughts, unable to sleep, unusual beliefs and hallucinations, so seeing, hearing or sensing things that others can't at the time. We know that the treatment really should ideally be admission to an inpatient mother and baby unit. So that's where specialist health professionals are trained to help the mother and the baby recover at the same time. And treatment normally involves medication in the acute phases, but lots of other interventions as well, like psychological and peer support. And we'll talk a little bit more about that later. So I'm just going to go into a bit more detail about the kind of early signs and symptoms with postpartum psychosis, because we know that recognising them can actually save lives. So here's some work that we conducted a few years ago by Jess Heron, CEO of APP, and the team, and it's looking at those early signs and symptoms in people who go on to develop postpartum psychosis. So I just want to point out that it's important that what's considered normal or ordinary for that person, so which is why it's really important that friends and family are involved in that really. And these kind of symptoms should be monitored really and just kind of kept an eye on. So here you can see just in this table the most kind of frequent symptoms, and that they range from kind of feeling excited, elated, racing thoughts, busy mind, increased energy, confusion, and no need for sleep. And when we're talking about sleep, we're not talking in those first few days where the baby's asleep and we're awake and trying to feed. It really is your brain can't switch off and you just cannot sleep at all. So just kind of acknowledging in most cases that there are these early signs and symptoms before the full-blown psychosis and kind of delusions and hallucinations. And in fact, most people can sort of look back and actually identify exactly when their first early signs and symptoms started, really. So if we spot these signs and symptoms, we need to get help quickly. So we can talk a little bit more in detail about that maybe in the Q&A, but just knowing your local pathway for postpartum psychosis is the key for getting that right help quickly. So whether that's accessing specialist perinatal mental health teams or admission to a mother and baby unit. So one thing to take away from today is knowing exactly what that pathway of care is in your local area. We know that recovery from postpartum psychosis can be quite complex and very individual, and we don't have enough time to kind of cover that kind of complex journey today, but I just want to point out a few key things really. So using some of the data that we've done in APP from 2010 and 21, we know that the average inpatient stay is around 6 weeks on average. But recovery can take anywhere between kind of 6 months to 3 years or more, really. It's very individual. We also know that the initial psychosis can be followed by other mental illnesses, so things like depression, anxiety, low confidence, and guilt and self-stigma. So the positive thing is really that we know that some people who experience postpartum psychosis won't endure a period of mood disorder again in their lifetime. But we do need to be mindful that sort of some people can experience further episodes of mental illness, such as depression and anxiety, even after the perinatal period, and then potentially go on and develop postpartum psychosis again. So it's just a few things to bear in mind. We've also found that about 50% of people who experience postpartum psychosis have suicidal thoughts in the year after being discharged from hospital. We need to know a bit more about this and understand that, but it's just to acknowledge really that the risk is there in the acute phases of psychosis, in those kind of early days, but also more in the long-term recovery as well. However, one of the kind of key messages that we want you to take away from today really is that although it is a severe mental illness and it can be quite scary, with the right treatment and support, families do make a recovery from this. So this brings me nicely onto introducing Shaheda, talking about recovery. So obviously Shaheda is a peer support facilitator for APP, as Sue said, and she's just going to share some insights into what happened when she was poorly. And we share our stories really just to give you an insight into what it's like to go through postpartum psychosis and an idea of kind of what helped and what might what might have helped at the time. So I'm going to hand you over to Shaheda now. So.
Thank you. Good evening, everyone. I'm really delighted to be here supporting Sally and sharing my story with you guys today. And then going on to talk about some of the work that I've been doing with APP later on in the presentation. So I had postpartum psychosis in December 2018, following the birth of my daughter. And as Sally said earlier, no history of mental illness, came completely out of the blue. And like so many women and families, had no knowledge of postpartum psychosis. People talk about postnatal depression, anxiety, baby blues, but people don't really talk about postpartum psychosis in the same way. So when I became unwell, neither me, my husband, my family members knew what was going on. And we're going to talk about antenatal education later on and how important that is. And I certainly advocate that as well. Had I known about it, perhaps that some signs and signals could be picked up sooner by my family, even myself as well, realizing that I was getting unwell. Something I do want to talk about very briefly, which I think is important in my PP story, is that there is some research that says that previous trauma can feed into women developing postpartum psychosis. So the two things I want to talk about are in 2017, I had two back-to-back miscarriages. There were early miscarriages, but the first one was really physically and mentally difficult. The second one I anticipated being as worse as the first one, but thankfully it wasn't. But you can imagine by the time I fell pregnant again in 2018, I had so much pressure and so much anxiety around whether or not this pregnancy was going to progress well. But the other thing I want to just quickly mention is I lost a son back in 2015. I had a very, very complicated pregnancy because I had high blood pressure, and the previous kind of 18 months before I got pregnant is when it got picked up, and they did lots of tests, scans, and all kinds of things trying to work out why my blood pressure was so high. But in the end, they couldn't give me an answer and just diagnosed me with essential hypertension. And the thing they didn't do was forewarn me about the risks and the implications of, having high blood pressure, especially uncontrolled high blood pressure in pregnancy. So when I did fall pregnant in 2014, almost like in the first 2 months, the complications already started. The problems with blood flow to the baby wasn't growing well. I was in and out of hospital a lot. I was told that I may lose my baby. And in the end, I spent almost 2 months in hospital because I just refused to what would happen is I'd get admitted, they'd bring my blood pressure down, send me home, then it would go up again. It was back and forth and back and forth. And in the end, he arrived nearly 12 weeks early by emergency C-section. But alhamdulillah, he had no medical complications at all for a baby who was so early. By the second day, he was breathing by himself. He was just small, and the doctor said, we just need him to grow and become strong and healthy so that you can take him home. And then it was just a stomach infection in the end. It literally happened overnight. We left the hospital at midnight because he wasn't settled and we were concerned, and they were running blood tests and things, but they told us to go home. They'd contact us if there was anything when they get the results back. And then 6 o'clock in the morning, we got a phone call to say, you need to come to the hospital now. By the time we got there, they were doing CPR, and we lost him. But we take comfort in the fact that we spent every single day on that neonatal ward with him. He had no complications. He wasn't in any pain or suffering, because there were a lot of babies on that neonatal ward that did have severe complications. I went through a lot, and it happened so quickly. He didn't suffer. And I'll touch on my faith and religious beliefs later on as well. But it's kind of like, if it wasn't for my religion and the conviction, the kind of explanation it gives to us and the comfort it gives to us in times of crisis like that. As a Muslim, we believe that when babies and children pass away, they go straight to heaven, and we took a lot of comfort in that, and that helped us kind of process that loss, which is, the kind of thing that you can't even imagine going through. So I think, like, consciously and subconsciously, those two things, the miscarriages and the neonatal loss, played a part in, the kind of stress around pregnancy. But actually, my pregnancy progressed really, really well. I was closely monitored. I was by Birmingham Women's Hospital were looking after me. I actually worked for them at the time as well. But lots of appointments, lots of checkups, lots of scans, and week by week by week, it progressed really well. I got to full term, and I actually enjoyed my pregnancy. It was I just enjoyed it. I had my induction date booked, but 3 days before my induction date, I got admitted. Went for a routine checkup. Signs of preeclampsia. We're admitting you. And this is, I'm going to move on to now my pre-delivery stay in hospital. I ended up spending 5 nights without any rest, any sleep in hospital. The first 2 nights on a maternity ward with women screaming and shouting and no sleep, no rest. 2 days on the induction ward. Again, lots of commotion. There was a lady who gave birth on the floor in the next cubicle. Again, it was just really just, it was just lots going on. 48 hours into the induction process, it just wasn't progressing the way that it should have. And I had quite a frank conversation with a midwife, and I'm really grateful for her for having that conversation with me and telling me that actually, you know, things are not going to get easier. Things are going to get more difficult if we progress. Just to be mindful of those things, and there would be some risks as well. And given all the history, and I spoke to my husband, and we didn't want to take those risks, and we asked for an elective cesarean. So back up to the ward, waiting for a slot on the surgery list. Day 6 finally got on the list. The actual delivery, the C-section, the time in theatre was really smooth. Everything went really well. The team were fantastic. The doctors, the anaesthetists, everybody really looked after me really well. But that's the end of my happy story, because I found myself, she arrived at 7:24 in the evening. I found myself up on the ward at midnight. You know, husband had gone home, all alone, exhausted from the lack of sleep, famished because I hadn't eaten all day. Then I felt kind of upset that I had to ask for something to eat and drink because I hadn't eaten and drank anything. And then I was just so overwhelmed with emotion, and the crying started and it didn't stop. And yeah, I struggled to breastfeed. Even when I got home, I couldn't sleep. I really struggled with the breastfeeding. And then the family came around and someone suggested, you know, why don't you give the baby formula? My husband went out and bought the formula, and I was absolutely devastated. I felt really betrayed by my husband. You know, I expected him to support me a bit more, to kind of persevere and try, but everything I was trying wasn't working. So let's put the next slide up now. This is like a timeline that shows kind of how I fell ill and gradually got worse and worse and worse. But rather than go through this, I'm just going to quickly talk through the right-hand side to give you kind of idea that the things that started to happen to me as I started to get unwell. So, you know, like I said, struggled to breastfeed, found that really difficult to cope with emotionally. But I did also have initial periods of elation and high mood, very, very chatty, very just a bit manic, I guess. But then slowly the paranoia, the confusion started. Again, saying what all women say, something just didn't feel right. And then I started to feel really, really scared. I thought that evil spirits were coming to get me and my daughter. I turned to prayer, so I was reciting verses from the Quran, playing the Quran 24/7 in the house. And that just kind of snowballed from there, really. The point I put there, I know most of you probably watch Stranger Things when they talk about the upside down, but that's how it felt. Like I was in this kind of parallel world where things seemed normal, but then just little things would just catch my eye. And I think, you know, what Sally said about seeing things and sensing things that weren't actually there, that started to happen to me. Everyone was conspiring against me. I couldn't trust my family members, couldn't trust the doctors, etc. But what I want to emphasize and talk about next is just those kind of missed moments where things could have got picked up sooner. And there's a couple of things that are not on my slide there, but the first one is just talking about that postnatal stay in hospital. That second night, I actually had a complete breakdown at the front desk, and I went out to the nurses saying, I can't cope, I want to go home, I want to go home. And I said, and they said, you can't go home because you're not well enough, we need to monitor you. And I still want to speak to somebody else. And the nurse in charge came to speak to me. And I said, I just want to go home. I can't cope. I can't get the baby to settle. I can't get her to latch. I can't do anything. And in the end, we ended up calling my husband to come back into the hospital and to stay with me that night. The next day I was discharged, thankfully. I was just so relieved to go home. But then 2 days later, I actually had an appointment back at the hospital for a checkup. And like I said, the crying started and just didn't stop. I went into the hospital with eyes like golf balls. I'd been crying, my eyes were swollen and red. But the nurse that I spoke to didn't seem to really be concerned in any way or ask me anything about it. In fact, it was me who brought it up and said, I'm really struggling with the breastfeeding. And what she said to me was, well, we have nurses who are specialists in breastfeeding. We can make an appointment for someone to come out and see you. So the next day, someone did come out and see me. Again, I was in a state already by that point, and I think it could have been picked up again by the breastfeeding nurse. Anyway, while she was there, she showed me what to do and how to do it, and it all seemed to be okay. As soon as she left, I couldn't get the baby to latch again. It was just like, oh my goodness. And then like my first episode was literally the day after we started my baby on formula. Like I said, that was kind of like the straw that broke the camel's back for me. And I felt a complete failure, a terrible mom, can't do anything. I just felt so upset and so down and so low. And then in bed that night, my husband passed me a piece of Indian sweet to eat, and I put it in my mouth, and it was like super glue. I couldn't chew, I couldn't swallow, I couldn't breathe. I thought I was being poisoned. I was thinking, who brought the sweets into the house? Who is it that's trying to poison me? I thought I was dying. And I almost had like an out-of-body experience, like when I was looking from the outside, and I was preparing myself to kind of like say goodbye to the world, and this is it, I'm going to die. And the next thing I remember is just being surrounded by my family. This is like late in the night. And my brothers were there, my mum was there, my sister-in-law was there. My brothers were checking my blood pressure, they were checking my blood sugar, they were checking my pulse. And I just was confused, like what was going on? Why were they here? When did they get here? And they started talking about calling out the paramedics. And I was pleading and begging with my brothers not to call the paramedics because I was scared they were going to lock me away and take my baby away from me. But they did call the paramedics out. And I actually ended up calling them out twice. The first time the paramedics came out, by the time they got to the house, I'd always kind of like calmed down and I was speaking quite coherently. So when they did all the obs and everything was fine and I was speaking coherent and I refused to go into hospital, they said there's nothing we can do and they left. The next thing I know, I'm in the back of an ambulance. So something must have happened and I must have had another episode and they called the paramedics out a second time. But I managed to, when they did the mental health assessment in the hospital, I managed to kind of fob them off by saying I was really tired and it was a sleep that was doing it. And I managed to get myself home. And then the same thing happened when I went to my GPs in the day 9. I went for a GP appointment again. I just managed to just blag my way by saying I was really tired and needed something to help me sleep and I'd be fine. And things just got worse and worse and worse. And then it got to day 18 when I had a complete meltdown at my GP surgery. It was another doctor on the day, not my own GP, and I was screaming and shouting, saying, I want to see my GP. They handed me a glass of water, they threw it across the room. And as soon as he walked in the room and saw me, he just realised how unwell I was. He was like, oh my God, she's really, really unwell. And he referred me to mental health services. That was on a Friday. By that point, my husband, even though I had family members come over and stay and try and help look after baby and look after me, my husband was finding it really, really difficult. And he said, I really can't cope. And my family suggested that I go and stay at my mum's house, where family members would come and stay at my mum's as well to look after me. That was on the Friday. By the Monday, when my midwife and house visitor came to see my mum, again, I was dancing around on the floor, trying to get under the sofa, and they just took all it and said, she needs help now. And they got me an emergency admission onto a general psychiatric ward. And I said, I've put here on my slide that that was my lowest point, because all that delusional thinking, having that special knowledge, I had to save the world. I'd got the secret of the universe in my mind, and the devil's trying to get into my mind to get that secret out. And actually, my second another general psychiatric ward, I felt that I'd failed. He'd got into my head, he'd extracted that secret, and I'd caused the end of the world. And I remember sitting on the end of my bed, crying, and the nurses were cleaning up all the mess that I'd made in my room. And I just kept saying, sorry, I'm so sorry, I ruined everything for everyone. And she said, no, you haven't, it's fine. We'll clean this mess up. You don't need to worry about that. And I said, no, you don't understand. And I was saying, this is it. This isn't going to be my perpetual hell. I'm going to be stuck in this room forever. and that's the end of me. And obviously that wasn't the end. And the next day, that evening, actually, my husband called me and told me that he was coming to collect me the next day, and they were transferring me to the mother and baby. I was really lucky that I only spent 2 days on a general psychiatric ward, and I got to the mother and baby unit, and I got the help that I needed. Sally, you can go into the next slide now, if that's okay. Yeah, and that's when my recovery really started. They gave me the antipsychotic medication, and I responded really well. And I felt almost as if I'd woken up from a bad dream and realised that I'd been really, really sick. And then that's the first time I had heard the words postpartum psychosis. So read all the information that was available on the board, the leaflets, the pamphlets, and realised, oh my God, that's what it was, and I'm going to get better and it's going to be okay. Still was quite frightened to begin with on the mother and baby unit, kept myself to myself and didn't really interact. It was over Christmas, there was no one else on the unit. So when I first got there, that kind of all fed into my paranoia that the doctors were fake, the nurses were fake, because I couldn't see anybody else around. And it was only my family coming in onto the unit to visit me. But obviously after the Christmas break, all the other patients came back onto the unit. And I just want to say that I was really lucky that I had a really supportive husband. I had my family all around me and gave me all the support that I needed. Initially, when I was having all those thoughts about evil spirits and things, my family did consider spiritual interventions. But when I didn't respond to, for example, verses from the Quran and reciting and all that kind of thing, they realized that it's not a spiritual affliction, that it's medical. And I got, they were open-minded to both. And I kind of got the medical help once I realized how unwell I was quite quickly. And again, it's my strong faith, my religious beliefs that really helped me get through the worst of it all and come out the other end, really. But I want to give a message of hope and positivity today, to say I went through, the worst of it, and you think that you're never going to get out of it, and you do get better. I made a full recovery within 6 months. I was back at work. So yeah, that's my story, really. I'm going to go on and talk a little bit about the work that I do with APP now. But the thing that's missing on these slides, and I've just realised I need to put them on there, is actually the support that I did get from APP in my recovery. And I had the one-to-one peer support, which was just amazing, to talk to other women who'd had postpartum psychosis and realise there were so many women out there who'd been through such similar experiences. Because a lot of women of different faiths also talk about how there were strong links to their Christian belief or other beliefs as well when they had the postpartum psychosis. So yeah, that's okay.
Thank you, Shaheda, and thank you so much. And it's so hard to kind of cram your experience into kind of yes. 15 minutes. So thank you for giving us a kind of, the key moments and the key things that, missed opportunities and things that helped you through. And thank you for sharing that really powerful story. So I guess just as Shaheda was talking about that kind of peer support, I'm going to just give you a little brief overview about the charity APP and what we do and the kind of support that we give families. So APP is a UK national charity, and we're a real collaboration between academic experts, clinicians, and families with personal experience. So we were founded at the University of Birmingham and supported by the National Centre for Mental Health at Cardiff University. And we're a network of over 1,000 people who've experienced postpartum psychosis throughout the UK. And we have over 3,500 online forum users. And I'll talk a little bit more about what that is as well. So a huge network of those that have been affected by postpartum psychosis. So we offer lots of information and support. So if you have a look on our website, we've got lots of information on there for families, but also health professionals as well. We've got guides that have been written by clinicians and people with lived experience. So we have recovery after postpartum psychosis, a guide for partners going through it, and a guide for those that are at risk of developing postpartum psychosis. And then we've just launched being a parent after postpartum psychosis as well. So please have a look on our website, lots of information there. I'm just going to talk a little bit about our projects. Sue, just put your hand up when we're running out of time. So we're originally a peer support charity. So we've been running just over 10 years, really. And so we have a big online community forum, which is manned by trained peer support volunteers. And that's there for anyone that's been affected by postpartum psychosis, and they can ask questions and talk with others that have been through it as well. We also have a one-to-one peer service, so that's where someone's matched with someone with their similar experience and they can talk to them and be supported by someone that's been through it. We have face-to-face APP peer support workers on the ground, which are in partnership with NHS trusts, and they're where peer supporters go into the mother and baby units and the community perinatal mental health teams and support people going through it at the time. And then we have face-to-face cafe groups as well, and online cafe groups across the country. And again, they're sort of spaces for people to connect and get together and peer support each other. So if you've got any questions, please do get in contact with Ellie and Jenny, who are our peer support coordinators. We know that recovery from postpartum psychosis has a significant impact on dads, partners, co-parents and the wider family as well. So APP's peer support kind of reflects that. So we have peer support for dads and co-parents. So we offer the one-to-one chats as well. And we have a partners cafe group online that runs every month, and lots of information and resources for partners and co-parents, but also grandparents as well. We run an online cafe for grandparents going through it as well, because we know it impacts the whole family. I'm just going to ask Shaheda to talk very quickly for a minute about the Diverse Communities project. So Diverse Communities is another part of the peer support that we offer. So I'll just give you a minute or two on that, Shaheda, if that's okay.
Yeah, I'll try and be as quick as I can. I think APP realised that there was a gap in terms of the women that come forward requesting support. Women from Black and Asian minority ethnic backgrounds are less likely to come forward and ask for that support. And we wanted to address why that was and kind of encourage more women to come forward. So it's myself, another lady called Zebanisa, and we both kind of work on the project. And Ellie is the national coordinator who oversees everything. You can go to the next slide for me, please.
Yeah, I'm going to skip that one, but talk about sort of what we've been doing. So yeah.
Yeah, so we have been running a Muslim Women's Cafe group bi-monthly, and the attendance has been on, up and down a little bit. So we're now looking at ways to kind of promote that a bit more, get a bit more uptake on that. One of the things I'm doing is trying to contact community organisations through social media, see if they can advertise our cafe groups for us, so we have more women coming forward and taking part in those. We're also thinking about setting up a Black Women's Cafe group and see what the uptake on that is as well. Yeah, we want to train more volunteers from those backgrounds to provide peer support and share their stories online and forums like this. I think there is a gap in terms of awareness in those communities, and I want to work with community groups to kind of raise awareness and to get people talking about postpartum psychosis and how to get help as well, how to recognise it. One of the things I feel really strongly about is working with religious leaders as well in the community, because like myself, it had such strong links to my Islamic faith that you know, when families approach religious leaders for help, saying, you know, my daughter, my sister, my wife is going through this, I want those religious leaders to have in the back of the mind, well, actually there is something called postpartum psychosis that has these strong links to spiritual religious beliefs, and to kind of just have that in the back of the mind and share that with people who might approach them and say, look, yes, you know, we're open to spiritual interventions, but do you know that after childbirth this can happen to women? So, and yeah, trying to get short videos of different health professionals from those backgrounds. And I think we've just recently launched one of those videos from a midwife called Marley. And I think that would be really impactful as well when people see health professionals from their kind of cultural backgrounds, their religious backgrounds, talking about the work that they do to help women with postpartum psychosis. I think that would be really powerful as well. Sorry to talk really quickly, but I'm just conscious of time.
Thank you, Shaheda. Thank you. Yeah, okay. So we've got lots going on in all our different projects. I guess the one thing I just want to highlight as well is we've got lots of projects, awareness and campaigns going on, and this is just something that's quite relevant. So I guess we've launched our antenatal campaign. What we found amongst kind of antenatal educators is that sort of 90% of people found that postpartum psychosis is something that should be talked about, really, and nearly 50% told us that they currently do talk about it. And the barriers to kind of talking openly about postpartum psychosis were that they had limited time, they didn't feel they knew enough about the topic, they didn't want to scare people, it's quite a frightening conversation to have. Some professionals felt that it was too rare to include, and that any women at risk would already be being seen by specialist perinatal mental health services. So using data from our survey and existing resources, we've created some antenatal education toolkits to help support professionals. So you can find them on our website, and it's currently under consultation. So please feel free to kind of feedback and have your say, completing our antenatal toolkit survey to help us kind of improve those resources, have a look around, see if they're useful to you. I am going to finish on that, I think, just because we've got lots of other things going on in APP that we haven't got time to talk about. I can't believe how quickly the time's gone, as Sue said. But I guess I just want to end really by saying thank you, and just acknowledging that we are fortunate to be here presenting today. So thank you. Without people like yourselves working together, it may have been a very different story for myself and many others. So on behalf of Shaheda and myself and APP, just a massive thank you for everything you do for families affected by postpartum psychosis. So thank you for listening.
Thank you.